Disc prolapse. So if you look at the normal structure of the spine, so this is how it looks like. I mean, the normal structure of the spine. If you see, so these are the bones in the back. Okay, so in between every two bones, you see a cushion-like thing. So these are called discs. Between every two bones, this cushion-like structure is called disc. So this acts like a shock absorber between the two bones. So what can happen? There are a couple of problems that can happen to this disc. So one problem is known as a disc prolapse, or we can also call it as a slip disc. And the second problem that can happen to the disc is degenerative disc disease. So this disc prolapse or slip disc can happen in the neck, can happen in the mid back, and can happen in the lower back. So if it happens in the neck, we call a cervical disc prolapse. If it happens in the mid back, it is known as a dorsal disc prolapse or thoracic disc herniation. And if it happens in the lumbar spine, we call it a lumbar disc prolapse. So of all the three things, the cervical disc prolapse, thoracic disc herniation, or the lumbar disc herniation, lumbar disc herniation is the most common one. Of the three, lumbar disc herniation is the most common one. So let's focus on the lumbar disc herniation. So what causes this lumbar disc herniation? What exactly is the cause for this? We do not know what can cause this disc herniation. But the incidence of disc prolapse or disc herniation is more common in smokers. So smoking is indirectly related to disc problems, and sometimes it can happen because of sudden twisting movements, sudden turning movements of the trunk. So if you kind of suddenly twist your back, so there is a possibility that you can develop disc prolapse. So what are the complaints of this lumbar disc prolapse? If you have a prolapsed disc herniation in the lower back, so patients have low back pain and they have radiating pain. This radiating pain also is known as a sciatica. So patient will have low back pain and the radiating pain. And if you look at the intensity of these pains, the low back pain and the leg pain, the intensity of leg pain is much more than the intensity of low back pain. And apart from the leg pain, sometimes patient can have a tingling sensation, burning sensation, and even numbness in the legs. So if the compression is very severe on the nerves because of the slip disc, sometimes patients can have weakness of the muscles supplied by that particular nerve. Say for example, if there is a disc herniation at L4, L5 level, it compresses the L5 nerve root, and this L5 nerve root is important for the dorsiflexion of the foot. That means, the backward movement of the foot. So there could be a weakness of the dorsiflexion, backward movement of the foot. So this is what we call a drop foot or a drop foot. So patients, apart from the pain, radiating pain, tingling sensation, burning sensation, numbness, they can have some amount of weakness of the muscles. Rarely, if it is a very severe or massive herniation, patients can have weakness of both the legs. They can lose control over urine and motion. So this is what we call a cauda equina syndrome. So slip disc with severe compression on the nerves, with weakness of the legs, and loss of bowel and bladder function is known as cauda equina syndrome. So if you look at the patient, the moment patients come to us, we examine the patient and we do a very simple test known as straight leg rising test. This straight leg rising test is, with the patient lying down, if you lift the leg straight up, keeping the knee straight, so patients feel as I lift the leg pain, whatever leg pain they have, becomes worse. So this is what we know as straight leg rising test or Lessegs sign. So if the straight leg rising test is positive, then we know there is some pressure on the nerves coming to the leg. That is most probably because of disc herniation. So the moment we do this test, and if it is positive, there is a strong possibility that the patient might be having a slip disc. So once we suspect that the patient has this problem, we go ahead, do investigations to confirm the diagnosis. So the basic investigation anyone does is an X-ray. But the important thing on the X-rays is in slip disc or disc herniation is the slip disc cannot be seen or visualized on the X-rays. So these discs cannot be seen. X-ray is done to know the alignment, to see whether the bones are properly aligned, or if there is any a fracture, or if there are any tumors in the bones. So X-ray doesn't show us the disc. So then we go ahead do what is known as an MRI scan. MRI scan will show us the disc, will show us the nerves. So whether there is a slip disc and how much of the disc has slipped back and how much of compression is there on the nerves. So MRI will confirm the diagnosis of disc prolapse. So this is how we investigate. So straight leg rising positive, then we subject the patient to the X-rays and then the MRI. MRI will confirm the diagnosis of disc prolapse. So once we make a diagnosis of disc prolapse in the lumbar spine, the first thing we do is to treat the patient conservatively. Conservative means the medical treatment. So the medical treatment includes medication and physiotherapy. So the medication would be, the aim of medication is to reduce the pain and if associated muscle spasm. So we give painkillers and some anti-neuropathic medications, and there is nothing wrong in using steroids also to get the pain down quickly. And then the physiotherapy includes what we call an electrotherapy. This includes an interferential therapy, or the other module what we call a transcutaneous electrical nerve stimulation. So medication and physiotherapy. And some people advise, some of the doctors, they advise bed rest for quite a few weeks, but one has to remember that bed rest doesn't have any role in the treatment of slip disc or disc herniation. If the patient has very severe pain, unbearable pain, probably we can give rest for a period of 48 to 72 hours till the acute nature of the pain comes down, not more than 72 hours. So there is no specific role for bed rest. If the patient has very severe pain, bed rest for about 48 to 72 hours. Pain medicines to reduce the pain and spasm, and we can give anti-neuropathic medication. So with the medical treatment, majority of the people, around 70 to 80% of the people, the pain comes down in a span of 4 to 6 weeks. And those patients who do not get benefit with the medical treatment, those are the patients we offer surgical intervention. The surgery what we do is known as a discectomy. Whatever portion of the disc that has slipped back will be removed. So there are various methods of doing this discectomy surgery. One is a standard open operation. The second one is known as a mini open operation. And third one is minimally invasive spine operation. So we are kind of almost stopped doing these open operations wherein they give bigger incisions, take out the bone, then take out the disc. So because of this, there is a lot of, even though patients get good benefit, there is a lot of post-operative disability, and it takes quite a bit of time for the patients to get back to their normal activities. So the surgeries which we do are what we call a mini open operation or a keyhole or minimally invasive spine operations. So the advantages with these mini open or minimally invasive spine surgeries are that we give a very small less than 1 centimeter or less than 1 inch incision, and with that we remove the disc. Because the size of the incision is very small, the post-operative pain is very less. The bleeding during surgery also is very less because the cut what we make is very smaller, and patients recover very quickly after surgery. And most of our patients after discectomy surgery, they go home within 24 hours. Say for example, if I do operation today morning, we make them walk today only and then send them home probably next day morning. So most of the patients, they get back home within 24 hours. So once they get back home, what we suggest to these patients is no bed rest. So whatever activity they can tolerate, we ask them to do those activities, and if the patient can get back to his job, desk job, whatever job he is doing, we encourage them to get back to their activities as quickly as possible. So these are the procedures which we do for simple disc herniation. The medical treatment in the beginning for a period of 4 to 6 weeks, and most of the people respond to this treatment. Those patients who do not respond to medical treatment, we offer surgery. Previously we used to do the open procedures. Now with the advent of minimally invasive spine surgeries, the recovery process has become much simpler.